Alcohol use disorder, or AUD, is a variety of symptoms that happens for people at different onsets and often progresses over a period of time. It is a treatable condition though, and there is always hope for people to heal.
One of the reasons that men typically use alcohol and are more vulnerable to use alcohol is because they use it to cope with stress and or to deal with negative affects and emotions. Men overall have a higher likelihood of developing an alcohol use disorder. They are 20% more likely to have one versus 5 to 6% of women. And one of the major contributing factors to that, in my opinion and experience, is the fact that it's more socially acceptable for men to drink versus women. So alcohol use does affect men and women differently. Of interesting note, while men have a higher prevalence of drinking alcohol, women have a higher prevalence of negative physical complications resulting from their alcohol use.
Women have different vulnerabilities from men, and they often include co-occurring disorders. Things like anxiety, depression, PTSD symptoms put women at an increased risk of alcohol use. And this is often because they're trying to manage the symptoms that they're experiencing from these mental health concerns. Additionally, there are societal norms for women to use alcohol as a way to unwind at the end of the day or as a reward for completing their tasks. And there's also a culture around women using alcohol as a way to connect and create relationships with each other.